Alrighty, looks like I'm live. Hi, everyone. So glad to see you here. I'm gonna wait for a couple people to hop on. I'm gonna tag some people in here as well. Let me see. If you're here with me live, just say hello. Give me a hashtag live. Let us boost in the algorithm because I think this is gonna be super important for a lot of people because we get asked a lot about GERD symptoms. So let me just tag some people in here to make sure people can show up and just chat with me if you're here. I wish there was an easier way to do this. We're going to talk about some cool stuff because there is a lie that big pharma tells us, and most people think that their issue with heartburn and GERD is a problem with low stomach acid, or too much stomach acid, but it's actually a problem with too low stomach acid. And we're going to look at the research and we're going to see why that is correct and why big pharma still recommends that people take these acid blocking drugs. That's because it is $1 billion business for them. They have no intention of keeping us healthy because then they don't profit. So unfortunately, that is where we're at with them, and we have to just do our own research, see what the research says, and then do what's best for our own bodies. So let me get a couple more people tagged in here that wanted to come to this. Then I'll get started. Hello. Hi, Desiree. Yes, thank you. I'm excited to talk about this topic because so many people ask about this. That's why I wanted to put this together. Tag one more person here. All right. Get some people on here. If you are here with me, say hello. I am going to go ahead and share my screen. Nice little Google slideshow for you here. Once I share my screen, I won't be able to see the comments and stuff, but what I'll do is I'll go through it and then I'll look at the comments and answer any questions that you guys have. This one. Here we go. All right. Let me just make sure this is showing up since I can't see now. All right, cool. Looks like the screen is up. All right, so today's presentation, everyone, why acid blockers and PPIs are making your GERD or heartburn worse. Big pharma's big lie. So what is the true cause of heartburn, indigestion, and GERD? And a lot of it has to do with our diet and lifestyle. Also, you are likely suffering from low stomach acid, not too much, like Western medicine treats you for. So we're going to go over, I have a little disclaimer for you. Then we're going to talk about what actually is heartburn and GERD symptoms. And I'm just going to call it GERD in general. So GERD is just a more diseased state as opposed to the heartburn, but to make it simple, that's what I'm going to refer to heartburn, indigestion, and GERD as is just GERD. So we're talking about symptoms, causes, the importance of stomach acid. We're going to cover conventional treatments. Then we're going to look at what does the research actually show, and then we're going to talk about some natural treatment. So first things first, this content in this presentation is not to be used as medical advice. This is for educational purposes only. Before stopping any medications or supplementing with any of the recommendations in here, please consult your health practitioner. Everybody is different. Nutrition is individualized. So please, 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 just because I say that this supplement is good does not mean it's going to be good for you. I don't know you. I don't have your health history. I don't know all the issues that you have. So these are just general recommendations in here. All right. So what is GERD? GERD, or gastroesophageal reflux disease, aka heartburn, is a condition that affects the esophagus and is defined by the experts as symptoms or mucosal damage produced by the abnormal reflux of gastric contents into the esophagus or beyond into the oral cavity, including the larynx or lungs. GERD can be classified as non-erosive reflux disease, NERD, or erosive reflux disease, ERD. Whether or not esophageal mucosal damage is present determines those classifications. And heartburn is one of the most commonly reported symptoms, affecting 60 million people at least once a month, and about 15 million people who experience it daily. That is not a good number. A lot of people are struggling with this, and it's really diet and lifestyle related. There is hope. You do not have to be on medication forever when you figure out the root cause and address that. So in patients with GERD or acid reflux, usually it's not that there's too much stomach acid, it's rather that there is too low stomach acid. So acid production might be lower than in healthier people, right? So you're not able to break down your food properly. And one thing that happens in healthy adults, part of the esophagus called the lower esophageal sphincter, or LES, that basically keeps stomach acid in its proper place. So when we chew our food, that bolus drops down, goes into the esophagus, and then there's a little sphincter between the esophagus and the stomach that's supposed to open and let that food through. And so if that sphincter is not working properly and it's not closing when it's supposed to, then that's when the stomach acid can come up into the esophagus. When that valve stops working properly, usually because it relaxes too much or it loses its strength, stomach acid then creeps up into the esophagus. The most common symptoms that develop as a result include chest pains, burning sensations, and difficulty swallowing. So more about the symptoms. So common symptoms: chest pains, painful burning sensation in the throat or chest. That's why we call it heartburn. Wheezing, symptoms of asthma, chronic coughing, and difficulty breathing, especially during exercise, when sleeping, or if you're also sick. Trouble swallowing or eating normally, developing like a sour taste in your mouth. That's that like reflux, that's that stomach acid, that nasty taste. Belching, sometimes painful symptom caused by gas trapped in the upper part of the digestive tract. So gas will get trapped up here, and then you're belching, and it can be painful. Excessive salivating, tooth erosion, and basically symptoms. These symptoms are classified either as typical or atypical. So most symptoms are strongest after eating. Bigger, fattier meals that consist of processed or acidic foods especially cause symptoms. Typical symptoms may include heartburn and acid regurgitation. Atypical symptoms include epigastric pain, dyspepsia, nausea, bloating, and belching. Many secondary symptoms related to GERD can also cause pain or dysfunction in the throat and esophagus. Examples include the coughing and asthma that I mentioned. The secondary symptoms seem to affect those with esophageal damage because there are shared nerves that control the cough reflex and the esophagus. These shared nerves can become inflamed and damaged over time. Esophageal acid exposure and mucosal damage can trigger reflexes that cause someone to gasp for air, having trouble breathing, and respiratory issues. And here's the thing. So with GERD, if it's left untreated, it can also lead to some serious health problems in some cases. So complications include Barrett's esophagus, an increased risk of esophageal cancer, worsening asthma, ulcers in the esophagus, and severe tissue scarring. Experts found that persistent GERD symptoms can take a toll on someone's quality of life, including both physical and mental health. A high percentage of those with GERD report reduced mental health. This lowered mental health also seems to decrease how well they respond to medications. So, this isn't just an issue where you can like pop some Tums and hope it goes away. We really need to fix this and get to the root cause so that you can heal, so that it doesn't progress into something more serious. So what causes GERD? In functional medicine, which is, really what I follow, I use the functional lab testing with my clients. I come from things in a functional medicine approach, looking at the whole person, not just managing symptoms like Western medicine. So what we ask is, what is the root cause of the problem and how do we correct it? For reflux, the root cause is sometimes very straightforward. It may be just simply what we're eating. Some common triggers of reflux include fried foods, spicy foods, citrus foods, tomato-based foods, processed foods, alcohol, caffeine, and smoking. But there are some other factors that can cause this as well. So eating right before bed, eating with an already full stomach, which can cause the food to come back up. Being overweight and having a big belly, which can push your stomach up, causing that reflux. Chronic stress affects the nerves in your stomach, making it impossible to process food properly. This will cause food to go up instead of down. So in fact, in order to digest your food well, you have to relax. So breathing before eating is a very important tool. Also, chewing your food properly, chewing your food enough is really important. And I always recommend that you also express gratitude for your food. I think that is a very important aspect as well. So whether that's saying a little prayer, like I do, or just even looking at the beautiful colors on your plate, looking at the wonderful food and just showing it appreciation for the nourishment it's going to provide your body, that can help put you in that relaxed state. That rest and digest is what we want. Loss of magnesium is caused by stress. Magnesium is needed to relax the sphincter at the bottom of your stomach, which actually lets the food go down. When you don't have enough magnesium, the food goes up. And I was just listening to a podcast, one of Dr. Hyman's podcasts, and they talked about, I think it was him and Chris Kresser, how many people are deficient in magnesium. It's almost 100% in the US are deficient in magnesium. Our soil quality is just so poor, we're not really getting it. And magnesium is involved in 300 different reactions. So it's really important that we have adequate magnesium. So another thing that can cause GERD symptoms, food sensitivities that may not be diagnosed by your average physician, including gluten and dairy. So it's really important to get a good, either go on an elimination diet and see if those are triggers for you, or get a quality food allergy test. I do not recommend any of those like Everly Wells or anything. They can be all over the place and not extremely accurate. bad bacteria or yeast growing in your stomach. So if you've been on a lot of antibiotics, if you have been on hormones, if you eat a lot of sugar and processed food, you could grow bad bugs in your gut, and they ferment and push things around and cause reflux. H. pylori, a bacteria that affects a number of people in our population, is often linked to reflux, because when you end up with low stomach acid, the bad bugs can thrive, and you end up with low stomach acid, even lower stomach acid, because you're put on these PPIs and these H2 blockers. So there's a whole series of causes, everything from what you're eating to your lifestyle, that really determines, what symptoms you're having. So now let's talk about the importance of stomach acid. So hydrochloric acid production during meal times is important to acidify your stomach and help the creation of chyme, which is like once you chew your food, that bolus, then it gets churned around in your stomach. And then you need this chyme to then pass on into the smaller intestine so the nutrients can be excreted by the microbiome. It also helps to break down proteins to make them more digestible for your body. So you absolutely need adequate stomach acid to break down protein. Protein is an extremely important macronutrient. Many people do not get enough, and they don't get enough of high quality protein. So it's really important. If you struggle with like eating meat and breaking down meat, you likely have low stomach acid. So it also allows bile and pancreatic enzymes to flow to help break down of proteins and carbohydrates and aid in the absorption of fats and fat-soluble vitamins. It helps your body to absorb minerals and trace elements such as magnesium, zinc, iron, and calcium. Aids in nutrient absorption, including vitamin B12, folate, and beta-carotene. It kills unwanted microorganisms from contaminated food, including bacteria, viruses, yeast, parasites, and molds. Protects your body from infections and pathogen overgrowth. Supports your immune system and reduces inflammation. It sends signals to trigger other important players of our digestive system, including our pancreas. So symptoms of low stomach acid production include bloating or distension after eating, diarrhea or constipation, flatulence after a meal, hair loss in women, heartburn, indigestion, malaise, which is just kind of like fatigue, and a prolonged sense of fullness after eating. And why that occurs is because your stomach, the food that you eat, is not being broken down properly because you don't have enough stomach acid to break it down. So it sits in your stomach. So you tend to feel full for a very long time because you're not digesting your food. So get my notes here. Digestion involves the breakdown of the large molecules into smaller, readily absorbed molecules. And while some digestion begins with the production of enzymes in the mouth, so that's amylase that breaks down carbohydrates, the stomach is where the process of digestion really gets underway. Cells in the stomach excrete specific enzymes to break apart fats, starches, and proteins. The enzymes, however, are inactive and must be activated by stomach acid. So when someone produces enough stomach acid, proper digestion in the stomach occurs. But many people don't produce enough stomach acid. Low stomach acid production is called hypochlorhydria. And when no stomach acid is produced, it's called achlorhydria. Decreased stomach acid production occurs from aging, caffeine, overeating, stress, medications, especially those that block the production or excretion of stomach acids, such as Protonix, Tagamet, Pepcid, Zantac, Prevacid, Prilosec, Acefex, Nexium, all of these things. Alcohol also plays a role, and stomach surgeries that destroy the acid-producing cells. So many people produce less stomach acid as they age, and it's been estimated that 10 to 21% of people ages 60 to 69 don't produce enough stomach acid. 31% of those 70 to 79 years old and 37% of those above the age of 80 either don't produce enough or don't produce any at all. This rate may be higher in people with autoimmune conditions. So when stomach acid is low, those vitamins and minerals may not be efficiently released from food that contain them. This may result in decreased availability of nutrients for absorption and nutritional deficiencies. People with low stomach acid have been shown to be at increased risk for vitamin and mineral deficiencies. For example, so low stomach acid is known as a known risk for iron deficiency. Stomach acid also plays two other important roles. It acts to sterilize food and signals the LES to close. So the gut normally contains about 400 different species of bacteria, which are required for normal digestion and absorption of nutrients. It has been estimated that there are more bacterial cells in the gut than all the cells in the body combined. These beneficial bacteria are required for normal digestion and absorption of nutrients. When inadequate sterilization of the food occurs, however, the pathogenic or the bad bacteria and viruses and fungi then pass into the small intestines. This disrupts the healthy ecology in the gut and alters the delicate balance between healthy and unhealthy microbes. This is called dysbiosis, and it can occur with the overgrowth of pathogenic bacteria or fungus. And symptoms include abdominal gas, bloating, postnasal drip, brain fog, sugar cravings. Sorry, package delivery. The dogs decided to bark. Where was I? All right. When low stomach acid production decreases the ability of the LES to close, the result is the acid production in the stomach can reflux up into the esophagus and cause these symptoms. The typical medical response to gastric reflux is to prescribe these acid blocking medications. However, the actual cause in many people, like I mentioned, is too little acid and not too much stomach acid. So when you look at the research, and there's been some meta-analyses, 9 out of 10 people that are prescribed these proton pump inhibitors, these H2 blockers, they actually have low stomach acid. So there's really only 1 out of 10 people, so 10% of people who are on these drugs actually produce too much stomach acid. So these pills, these medications are making your symptoms worse, which is not good. And then it's also leading that low stomach acid, just like I mentioned, when you have low stomach acid, then it can lead to dysbiosis. It can lead to these gut infections like H. pylori. So they're really exacerbating your symptoms. And pretty much everyone I've talked to doesn't get relief from these. And if they do, it's very temporary, it's very short-lived, and plus they deal with side effects. So you really want to take the time to understand the underlying possible causes and then work to correct them in a more rational approach than just prescribing people something to manage these symptoms, right? Doing so could not only help more people improve their health, but also avoid these dangerous drug side effects, which we know they have. So conventional treatment, every day, millions and millions of people take these acid blocking medications to treat the symptoms of acid reflux for duodenal ulcers and as an important part of a treatment strategy to kill the H. pylori infection. The US FDA approved these medications, which include popular brands like the ones I mentioned before, for the short term. However, people often end up taking these medications long term for many years, despite the fact that the FDA never approved them for longer than a couple of months. While these medications, like many medications, are effective at treating the symptom of disease, often they don't treat the underlying cause and they can create deadly consequences. So one of the things that Dr. Hyman talks about before he kind of made the transition to functional medicine is that some, pharmacy reps, the pill reps, right, came to him when they first came out with, these acid blocking drugs, and they're like, hey, you can use these for your patients, but here's the thing, you can't have them be on them for too long. They're very strong, right? And they will cause low stomach acid. And so it's supposed to be very temporary. You don't want them on them for like more than 6 weeks. And now people are on these for years and they keep getting worse. And that's because they don't have enough stomach acid to break down their food. They're nutrient deficient. They are basically starving because they can't absorb, they can't break down the food to get the nutrients into their bodies. Even if they're eating, their cells are starving because they're so nutrient deficient. So there are 2 classes of these acid blocking medications, proton pump inhibitors, PPIs, and histamine 2 receptor antagonists, or H2 blockers. PPIs include Prilosec, Nexium, Prevacid. H2 blockers include Zantac, Prilosec, and Tagamet. PPIs lower stomach acid when there's already too little of it. Like I mentioned, inadequate stomach acid leads to those painful symptoms, which can lead to esophageal cancer and poor health in general. Because like I said, it impairs the absorption of protein and the important nutrients like iron and B vitamins. Also, like I mentioned, when stomach acid is insufficient, infectious microbes are nullified upon entry and can take root in the body. These may develop into parasitic infections, SIBO, a disrupted microbiome, or a host of other problems that arise from poor gut health. $10 billion is spent annually on just the OTC. That's not even including like the prescription. And this was an old number too. I found some different numbers. I think it's actually more than this. But $10 billion on these drugs alone, and doctors may be over-prescribing these. So there's actually a survey done from the product lawyers who are working with a large number of people and pursuing lawsuits against these drug companies about these type of drugs. 54% of patients were prescribed PPIs outside of the current guidelines of what they should be prescribing them to certain symptoms, certain people, right? 54%, so more than half were being prescribed these drugs, and they don't even meet the criteria to be prescribed these drugs. 33% of patients showed no indication for PPI prescription at all. So a third of these people don't even need these drugs, and they're causing more harm than good. That's because we know, that's why you guys are in this group, right? Big Pharma lies. They're all about profit. They don't care about getting us healthy. It's all about marketing. It's all about advertising. It's all about making money. They have no intention, don't care about our health at all. We have to take it into our own hands, right? PPIs have been linked to severe side effects, including kidney disease, renal failure, heart attacks, pneumonia, dementia, bone fractures, and vitamin and mineral deficiencies. So now we're going to talk about what the research shows. So a 2016 study published in the Journal of American Medical Association, they said studies in animals have challenged the traditional notion that reflux esophagitis develops when esophageal surface epithelial cells are exposed to lethal chemical injury from refluxed acid. So that's that damage, right, that we were talking about, that I was mentioning earlier. So in these animal models, that's not what was happening. So while acid reflux, regurgitation of acid into the esophagus, likely contributes to GERD symptoms, new findings suggest that the root cause of GERD are actually tied to abnormal inflammatory responses. Inflammation develops in the digestive system, including the esophagus, through the secretion of proteins such as cytokines, which damage esophagus tissue cells. So I want to break that down a little bit. Everything starts with inflammation, all of it, like all these diseases, all of these chronic diseases, it's all about inflammation, and inflammation starts in the gut. So when you are not properly when you don't have good gut health, when you have all these bad bacteria, you can't break down your food properly, end up with things like leaky gut based on our stress, based on, the type of diet that many of us have, these medications, it causes leaky gut. So we have tight junctions in our gut that are really only supposed to let vitamins and minerals and important nutrients through into the bloodstream. But those tight junctions break apart when there's inflammation. And then bigger food molecules can get through, toxins can get through. This is how people get candida overgrowth systematically, because candida will escape through the gut, translocate into different parts of the body. So this all starts with inflammation. So what they're saying here, what they found here is that, yes, the acid reflux contributes, but it all starts with inflammation. So there's inflammation started in the gut, which likely prevents that thing from closing, right? The LES. And then you have inflammation in your esophagus. So that LES, because of the inflammation, it's not closing properly. And then that acid is coming up, which is now burning and making your symptoms worse. But it all starts with the inflammation. So here are just some quick little things. And then I have some deeper studies too that I'm going to share with you guys. PPIs more than double the risk of death from a cardiac event. They increase the risk of kidney disease. They interfere with your microbiome balance and lead to dysbiosis. They increase the risk of all-cause mortality, increase the deficiency in vitamin B12, and increase in the development of osteoporosis and increase in hip fracture. Increased risk of stomach cancer, and 44% increased risk in developing dementia. Like, that is crazy, you guys. Like, dementia is a horrible, horrible disease to see someone go through. You sure don't want to go through it. We don't want to see our loved ones go through it. We don't want to put our loved ones through us going through that, right? So these are some serious, serious side effects, when really you need to control your inflammatory response. You need to eat a healthy diet. You need to figure out if you have some gut infections, if you have some dysbiosis, get some functional lab testing, get to the root of this issue instead of making big pharma wealthier than they already are and making yourself sicker, because then they're going to suggest who knows what other drug for you. Oh, well, now you have this, so take this. And, before you know it, you're on 10 different medications. So let's talk about a little more studies here. So Stanford researchers did a robust study of 2.9 million people and concluded that PPIs more than double the risk of death from a cardiac event. These drugs are also associated with increased risk of kidney disease and dementia. A longitudinal observational cohort study on U.S. veterans looking at mortality rates, associated mortality, and PPI and H2 blocker medications found 45 excess deaths per 1,000 patients in those taking PPIs, including infections, parasitic diseases, neoplasms, and genitourinary disease associated with PPI use. They found excess mortality due to cardiovascular disease, kidney disease, and gastrointestinal cancer associated with PPIs. Research has found that long-term reduction of stomach acid through PPI use can interfere with your microbiome balance and lead to dysbiosis. It may increase the risk of food poisoning, diarrhea, SIBO, parasite overgrowth, yeast overgrowth, and microbiome imbalance. A systematic review of 37 studies investigated the connection between PPIs and morbidity and mortality. They found that PPIs can increase the risk of all-cause mortality. They also found that long-term use of PPIs can increase the risk of cardiovascular morbidity, cardiovascular events, and cardiovascular mortality. Studies show that people who take acid-blocking medications for the long term can become deficient in vitamin B12, which can lead to depression, anemia, fatigue, nerve damage, and even dementia, especially in the elderly. The research also tells us that taking these drugs can cause dangerous overgrowth of bacteria in the intestine called Clostridia, leading to life-threatening infections. For many more people, low-grade overgrowth of bacteria in the small intestine leads to bloating, gas, abdominal pain, and diarrhea. These are listed as common side effects to these drugs. This can cause IBS. In addition, a recent study in the Journal of the American Medical Association found that chronic use of acid-blocking drugs leads to an increase in the development of osteoporosis and increased risk in hip fracture because blocking acid prevents the absorption of calcium and other minerals necessary for bone health. This is only part of the problem. There have been some reports that these drugs may increase the risk of certain cancers. Zantac was pulled off the shelf in April of 2020 after it was found to contain unacceptable levels of potential carcinogen called N-nitrosodimethylamine. We'll call that NDMA, not MDMA, NDMA. And another study here, I mean, I got a lot of studies. A 2018 study published in the journal Gut concluded that these drugs increase people's risk of stomach cancer. The researchers followed 63,400 patients for 7.5 years who had been prescribed long-term acid blocking therapy. Using these was associated with increased gastric cancer risk, while H2 blockers were not, though. So this was just the PPIs. The longer someone used PPIs, the greater the risk. After just 1 year, the risk was, get this, 500% greater than people not taking acid blocking medications. And then after a year, that number increased to 834% increase in risk of developing stomach cancer. That's a huge increase. You get 1 year on these increases your risk of stomach cancer 500%. From a normal person not taking these drugs. That's just absolutely scary. In a second study published in JAMA Neurology in 2016, acid blocking medications were associated with increasing dementia risk. The German study evaluated medical records of almost 74,000 people ages 75 and older. Researchers found that regular PPI use increased dementia risk 44% compared with those not using the drugs. Both PPIs and H2 blockers have also been shown to increase hip fracture risk in people with osteoporosis. In 2010, JAMA reported that risk of hip fracture increases by 22% after 1 year and nearly 60% after 4 years. So, you know, these are serious health concerns, you guys. It's pretty clear that in this case, the cure of these acid blocking drugs is worse than the disease itself. But that's little comfort, right? When you're struggling from heartburn. So yeah, one more study. Another JAMA study in 1998 concluded that fatal drug reactions for hospital patients appear to be between the 4th and 6th leading cause of death, and the rate of fatal drug reactions had been stable for the past 30 years, killing more than 100,000 people annually. While medications can be extremely helpful and indeed life-saving, the data is clear. Medications can also be very dangerous. One always has to balance out the potential risks with the potential benefits, and the discussion should always be between you and your healthcare provider. So now that we know these drugs are bad, right? We want to get to the root cause, get some gut testing, check for H. pylori, see where your stomach acid levels are, and get to the root cause. And we want to treat it. We want to treat it naturally. So we want to follow an anti-inflammatory whole foods diet. It incorporates a diet rich in phytonutrient, dense vegetables, healthy fats, and clean protein sources. Healthy fats include coconut products, avocados, olive oil, purified omega-3 fish oil supplements, healthy proteins, well-caught fish, grass-fed beef, free-range poultry, and eggs. Include lots of anti-inflammatory herbs, curcumin, cinnamon, ginger, oregano, garlic, all very beneficial. You want to remove food triggers. So allergy testing or an elimination diet can be really beneficial for that. And we also don't want to eat late at night. So give yourself 2 to 3 hours at least before bed to not eat. Using apple cider vinegar. So you can have 1 to 2 tablespoons of apple cider vinegar and about 4 ounces of water 10 minutes before a large meal. It has natural acetic acid that helps reduce the pH of the stomach environment, and it also activates the vagus nerve, which turns on the production of stomach acid, bile, and pancreatic enzymes to digest food more efficiently. Using digestive enzymes. So a good digestive enzyme supplement can help you break down food more effectively and reduce the stress on the entire digestive system. And as we age, we produce less digestive enzymes. So, it can be beneficial, especially if you're going through a gut healing protocol, to take them. I took them regularly when I was going through my protocol. Now I don't take them often. I don't need to take them often unless maybe I'm having like a very fatty meal, a celebration, or if I'm going out to eat or something and I'm worried about like cross-contamination with gluten, I will take some then. Then we want to consume fermented foods regularly to help. This one, though, if you have something like SIBO, or this could cause some issues. So, be very careful with this one. Lemon and ginger, you can put drinks. So I have my water every day. I have lemon, lime, ginger, cucumber, and mint in here. It helps with digestion. They have key nutrients that enhance that HCl production. Reduce stress on the digestive system. So, if you're super stressed out, like don't eat a bunch of food while you're stressed. It reduces the secretion of digestive juices and enzyme production. So you want to make sure that if you are in a state of stress, you're not stress eating. That's really important because that can make those symptoms worse. You can use a hydrochloric acid supplement. It supports nutrient absorption and helps maintain that healthy gastric pH, which in turn just helps your gut health, prevents this. It's good to look for a betaine HCl product that it also contains the protein degrading enzyme pepsin, which is also produced in the stomach. You can find products with just those two ingredients, or you can find products with glutamic acid, bitter herbs, that help to stimulate that stomach acid production. And in some cases, you'll find it combined with ox bile and pancreatic enzymes. Be really careful with this. Again, like I mentioned, this taking that supplement might not be for everyone. So make sure that you are talking with your practitioner about that before you include anything like that in your diet. You want to improve stress, reduce stress, and improve sleep. That's just going to help your whole system. That's going to reduce inflammation. That's going to allow your body to heal. Really, really important. We want to heal gut infection. So again, that testing, make sure you don't have an underlying infection, H. pylori, parasitic infections, dysbiosis, SIBO, something like that. Some additional supplements include DGL licorice, glutamine, aloe, probiotics, magnesium, and zinc carnosine. Those can also help. So we'll say like one little recommendation here. So take 2 to 3 capsules of digestive enzymes with each meal. You want to re-inoculate the gut with healthy bacteria by using probiotics. You want to make sure I follow the 5R protocol. Before you re-inoculate the gut, you've got to remove what the triggers are. So you've got to get to the root cause of the heartburn and figure out what your triggers are, because it's going to be, if you have SIBO and you start throwing a probiotic in there, it's going to make it worse. So zinc carnosine, 75 to 150 milligrams of zinc carnosine twice a day between meals. It's been extensively studied and is used frequently in Japan. You can take 3 to 5 grams of glutamine powder in water twice a day to help heal the gut lining. I still just take that regularly. It's an amino acid. It's very safe. I get natural factors, and it's just a powder. I mix it in my greens drink in the morning and I take it. You can chew 2 to 3 chewable tablets of DGL 15 minutes before meals to help. You can try 200 to 400 milligrams of magnesium citrate or glycinate twice a day. Also be careful with magnesium supplementation. Too much can cause bathroom issues. So if you're still not better after you've kind of changed your diet, you've done some of these steps, right? Let's get tested. Let's get a GI map. Let's get to the root of this issue. If like diet and lifestyle and some supplements didn't help. You really want to figure out what is going on. So you can get that from a functional medicine doctor, or, you know, a functional nutritionist, someone who runs tests like I do. You want to test for H. pylori, you want to check for celiac and gluten sensitivity, check for other food sensitivities, check for those abnormal bugs in your gut, bacterial overgrowth, yeast overgrowth, and parasites. So GI map test and a food allergy test are going to cover many of those things. A lot of times that's what I typically start my clients off with if they're having a lot of GI issues, are those two tests. So I think that's it. You know, if you're ready, if you are like, okay, I'm ready to get to this problem once and for all, you can always book a call with me. Calls are free. And can see if I can help you. Let me get back to stop sharing my screen. Okay, which window am I at? Okay, here we go. All right. Oh, okay. So let me read here what we got going on now. Hydrochloric acid, one of your favorite subjects. That's awesome. Desiree, Shara, love this topic. Awesome. Yep, diet and lifestyle are definitely the main culprits. Hey, Anne. All right. So, I mean, I think that's all I have. If you guys are watching the replay, drop me a hashtag replay. Let me know what your takeaways were. Let me know if you have been on these acid blocking drugs and what your experience has been. Has it helped you? Have you noticed things have gotten worse? How long have you been on them? If you have any questions about any of this, please feel free to message me. And if you're really struggling and you're ready to get to the root of this issue, if you've been dealing with this issue for a very long time and you are tired of being prescribed these medications that aren't working, you know, give me a call. Let's set up a time to chat. Let's get to the root of your issues and get rid of this, because we should feel good. Food should nourish our bodies. We should feel good after eating. We should all feel happy and healthy. And we should not be stuck to, you know, taking these pharmaceuticals that really are not benefiting us in any way for long periods of time. So I hope that was helpful, you guys. I really wanted to, you know, come out with this because we get so many questions in the group about, you know, heartburn and acid reflux and GERD. So I hope this answered a lot of things for you, and I hope you found it helpful. Let me know in the comments if you have any other questions, and we'll talk to you guys soon. Have a good rest of your day. Bye.